Good evening, everyone. This is IMG Research Academy. IMG Research Academy is an online research academy where we talk all things clinical research. We have membership cut across the globe, especially people who are trying to get into the US residency pathway. It's a platform where we share minds, share ideas on research methods, how to write, how to do, how to conduct, everything in between. Um, Majority of us are physicians, either in different stratas of learning, those that are attendings, those that are coming up as students, and those that are trying to get into residency or those within residency. We've been doing this for the past 3 to 4 years, every Sunday or most Sundays. We meet to rub our minds together. We've covered a lot of topics. One of the very interesting topic is how to write a conclusion. And there's so many articles out there when I was preparing for this, so many articles on how to write an effective conclusion and different styles of conclusion. But the conclusion, it's a very critical and important part of your writing. After the hard work, 5 months of literature review, or 2 months or 3 months of case studies, or 1 week of case study or literature review, depending on how many your team is. And then you've gone through all the methodologies, you've gathered your research statement or your research question, you've gathered your hypothesis, you've structured your result, you've structured everything, you've done your discussion. The conclusion is one of the most important end pieces of a good research. What is the purpose of a conclusion? Basically, the conclusion provides like a concise, direct summary of what I found, full stop. So when someone reads your conclusion, the person should be able to at least 60% or 70% of the time figure out what the whole narration in the whole paper was, right? If your conclusion doesn't come off as that, simple, straight to the point, addressing specifically what the entire discussion or what the entire paper is all about, just like the abstract does, right? The conclusion tells you what were the key major findings. That is the purpose of the conclusion. It's also in the conclusion that we draw correlations. There might be a relation between this is directly correlated or this is directly implicated. Those are where we make those kind of statements. This is not related or is related, or this is different medical explanations or correlations that answers the research question. So like, discussing the broader implication, this is why this explains this. So this is what this explains that. Also in the conclusion section is a place where you find most new hypotheses or new research questions. I keep telling many of I'll use the word students, I don't mean that you're students now, that if you're looking for research ideas, just go online, go to many conclusions, you see tons and tons and tons of research ideas in the conclusion section. If you're interested in obesity research, look up obesity papers, you see that many people have adopted that style of suggesting future areas of research in that area of obesity. If you are in psychiatry or you're in pediatrics or you are in allergy, immunology, wherever you are, look up an immunology paper and you're looking for an idea, go to the conclusion section. You're going to see tons of ideas because they're going to make broad future kind of, most conclusions make those kind of futuristic suggestions on what next do we need to do. Okay, we found that there's a relationship between A and B. What next? All right, that's what the conclusion section does. Let's look at some basic principles. One of my teachers when I was in Arizona State University says that if you write a conclusion and it's just more than one paragraph, just one short paragraph, he emphatically said probably about 5, 6 statements, your conclusion shouldn't exceed that. You're not hitting the point, you've been rambling. So it has to be very, very concise. concise. Now, if you remember that in the paper, there's a results section, and in the results section, you've already had your different relationships or different variables and different correlates, right, with their confidence intervals or their statistical significance, if that's the kind of paper that you did. If it's just a narrative, in your discussion section, you also have, what you're discussing, that, okay, the whole idea is towards A and not towards B, right? In the conclusion section, you're not going to go through all the entire pieces of puzzles in the results. You will just go straight to there was more incidence of this. Our paper found that there was more incidence of stroke in males than in females. Full stop. You're not going to add the confidence interval that is the strength of correlation. Those p-values and confidence interval are called strengths of correlation, sometimes called the strengths of your finding, right? So you just go straight. We found that there was a relationship or there was no clear relationship. And one key takeaway, for example, not before the key takeaway, for example, if you look at this statement, our study reviewed that the new drug significantly reduces. So it hits the objective of that particular study. Reduces blood pressure in patients with hypertension compared to the standard treatment. Full stop. I didn't go into why it did it. I didn't go into the statistical significance or not the statistical significance. I didn't go into the history of why it did it. I didn't go into what I think. That's another thing, but you didn't go into what my thought process is. Okay, I think that this is why. I didn't go into any explanation. I just one line and that's it. And then if you have space, you can, you can put in a recommendation or a suggestion, right? Potential something or potential idea that's gonna help snowball the whole process. We recommend that, statisticians, or we recommend that the physicians pay more attention. If it's case report, you're try to talk about the particular rareness of a particular disease. Disease is becoming common, and you should be more vigilant in this, like a broader kind of suggestions. And then you can also make recommendations to bodies, corporate organizations, health organizations. You can make recommendations. If, let's say, for example, you are reviewing a guideline between two bodies, let's say American guideline versus Canadian guideline. In one of the papers that we wrote, we reviewed inflammatory bowel disease, the guidelines in Canada versus the guideline in the US. And, we made recommendations based on our finding. And you're a scientist, don't be shy to stick up your voice and just say, this is what I found. There's variabilities in this guideline. There's no variability in this guideline, or there's no variability, whatever you want to recommend to them. And you think people are not reading this. I gave a story one time, that, some higher authorities have contacted me on some of the things that I wrote. They pointed out that I should make some corrections somewhere and also praise some other areas. People are actually seeing your work and people are following through. And for us in IMG Research Academy, we often always emphasize on quality of what you do. So it's a great place to do a recommendation as the next line, and then suggest a research gap or suggest a way to point out any limitations of your study or propose a new way to expand a particular area. Remember, part of the reasons why we're doing research is to find out, and then you now propose further findings. If what you did has some limitations, you could propose further findings. For example, future research should explore. So you almost always see future research in many of our papers. Future research should explore, future research should explore. There's need to continue researching. There's need to explore the relationship between SGLT2 and heart failure. There's need to consider future research on the side effects of this medication for those that are doing different studies. In the conclusion sections, you see that. So if you find out, if you look at my presentation, I've basically done my conclusion like 4 statements. 4 probably simple or 4 complex compound statements. First, we usually state your research objective or your research question. This research was done for this purpose. And then our findings included a direct relationship between X and B, or no direct relationship. And yeah, that's also something I forgot to say. Ensure that whatever you're finding, if there's no relationship, because the research could be positive and the research could be negative, or research is maybe neutral, like we couldn't find any relationship, we couldn't find any correlation, we found a correlation, we couldn't find any correlation, or it's inconclusive, right? Our thought process is inconclusive. And don't be shy to say that your findings were inconclusive. You couldn't come to a resolution on whatever it is, right? Because probably there were variables that were not in consonance with what you actually see with your hypothesis or your null hypothesis, right? They were not in consonance with what you thought it could be. So I promise to keep this presentation for 5 minutes so that we can jump into other things. Key takeaway: be clear and concise. Present a conclusion based on your evidence, not on personal opinion. Review and revise your conclusion for clarity. Use very simple statements. In our Research Academy, we've emphasized over and over again, use very simple statements. Don't go ambiguous. If you find out that many of those ambiguously written papers are very hard to follow, you kind of wonder what kind of jargon is this person speaking, right? The last thing I will say is that in a conclusion usually does not contain a citation. So it doesn't contain like references or in-text citation or whatever citation. It should just be the hypothesis, the statement or the objective statement or introduction to the objective statement that will lead you to your finding, and then will lead you to, if you have a broader implication, this means that blah, blah, blah. And then you make your future statement. The fourth one, you make your futuristic research proposal based on what you're finding. And that could also lead you to the next thing that you're going to do on that paper, and then the next thing. And then you finalize, right? So basically 3 or 4 statements. We wouldn't stress this more than this. I want everyone to, at your own pace, go online. You're going to see tons of conclusions that were written in so many journals. Whenever you're writing your paper, sit down and look at how authors of that particular sit down and look at how the authors of that particular paper structure their conclusion. You can also pull up this presentation. We're going to post this presentation later on today, and then follow the guideline 1, 2, 3, 4 statements at max. You should be done and dry. Conclusions are usually a very high point. Most of the time when I read papers, I just read the abstract, go to the conclusion, or read the introduction, the background, and go to the conclusion. Then we skim through the entire paper, the many of that, and that's how you are able to cover, or what they call it, screening, to screen as many as 300 papers or 200 papers in a very, very short time. So just reading, okay, what did they say? What did they find? Okay, what did they find? Okay, what did they find? Then when you now find it very interesting, you can now go to the details in the results section or in the methodology section. Okay, how did they find it? How did they make this conclusion? How did they arrive at this conclusion? So for people who are also reviewing many of our papers, or people who are reviewing papers for other journals, we also want you to pay attention. If you come across a conclusion that is so ambiguous, lengthy paragraph, most likely than not, the person must have gone tangentially off the radar. Give me 1 minute. Okay. And these are the takeaways, the references I can provide this on the slide. Thank you so much. This presentation was brought to you courtesy IMG Research Academy. We're going to stop the sharing and also stop the recording for this particular session. I hope I was even recording it. I believe so. Okay. Thank you so much, everyone. We'll move on